This is your COVID-19 update for today, Thursday, August 25th, 2022, where we'll be speaking with Honorable Dr. Frank Anthony.
So over the last 24 hours, we had 38 new cases, and we are currently monitoring 312 cases that we have across the country. So right now we have 10 people in hospitals. 8 of those persons are at Ocean View, with 2 of them in the ICU. So yesterday we did 232 doses of vaccines. We administered 232 doses of vaccines. So that would take our numbers up slightly. So first dose, we now are at 445,855 first doses. That's approximately 86.9% of the adult population. Second dose is now 345,610 doses. That's now 67.4% of the adult population. In terms of 12 to 17 age group, we're now first dose at 35,561 doses. That's 48.8% of that age cohort. Second dose is now 26,069 doses, or 35.7% of that age cohort. And for children between ages 5 to 11, we're now at 7,774 doses, or 7.6% of that population. And second dose is now 3,008 doses, or 2.9% of that population. Boosters right now is at 72,329 doses. We have worked very hard to get vaccines, especially for the 5 to 11 age group in the country. You would recall about a month ago we received 52,800 doses from the US government, so we have adequate supplies of vaccines. What we would like to see is the parents making sure that their children are properly vaccinated. So there's a lot of room for growth because we only have 7,000 receiving the first dose, and therefore we would like to encourage those parents who haven't brought their child as yet to make sure they do so. What we have seen is that the virus, SARS-CoV-2, has changed over the duration of the pandemic. So at the beginning, the strains that you had, like alpha, beta, gamma, delta, and so forth, that has now changed, and the pattern of disease has changed with it. So you'll recall with the delta variant, we were seeing a lot of cases where people were having severe respiratory problems. Now with Omicron subvariant BA.5, you're not seeing that. So a lot of people are getting a milder form of the infection, and so the pattern of the disease has changed, where you're seeing this milder form of the infection. Incubation periods have shortened, and that's why I think the CDC has recently changed their guidelines. So they no longer require persons to stay at home if they test positive, but if they're going to go out, they need to take precautions by wearing masks, an N95 mask, so that they don't infect other persons. So that's a very important thing. But we might have situations where people test positive and they're in the general public without any protective gear. And if they do that, that's highly irresponsible because they are going to infect other people. Well, we have set up guidelines of what we would do when we have a patient, and the staff in the ministry would have followed those guidelines. So one, if we suspected that someone presented clinically with monkeypox, then we have to confirm that diagnosis with laboratory tests, which we have done. Once the diagnosis is confirmed, that patient is going to be isolated for 14 to 21 days, depending on what period of time that patient came into us. And it's a self-limiting disease for most cases. So after that duration, the patient should be well, and we should be able to discharge that patient because they would no longer have signs and symptoms and they're not infected. So that's important to note. And for the persons who the patient might have been in close contact with, that we quarantine those persons and monitor them for 21 days. So that's what we're doing right now. So there are two main types of vaccines that are used for monkeypox. The first one is called ACAM 2000, which is really an old vaccine that has been around for a long time. ACAM 2000 is one that has been used for smallpox, but they found that when people were administered this vaccine, it was protective against monkeypox. So some countries have stocks of ACAM 2000, and they have been using it to prevent monkeypox from occurring in certain population groups. But because it's an older vaccine, it's not recommended that it is used widely, because there are certain disadvantages with it. The newer vaccine is called an MVA vaccine, and it goes by different names. So in the US it's referred to as Janus. In the EU it's called Imvanex, and in Canada it's called Imvamune. So it goes by different names, but technically it's a modified Vaccinia Ankara virus, and by modifying this virus they have been able to see that when they administer it, it's very protective against monkeypox. It has less of the side effects than the previous one, and so this one is highly recommended. This is the vaccine that we are working to get into Guyana. In this context, because of the vaccines being very limited, one of the things that have been recommended in the countries that have started to use the vaccine is to determine the person's risk. So you can group people by their levels of risk. So the vaccine, this Janus, the MVA, what they have recommended is not to give it as a pre-exposure prophylaxis type of vaccine, meaning that you give it before somebody has been exposed, but rather you do it as a post-exposure vaccine. So the main thing here in administering, or the criteria to administer the vaccine, would be that the person must have been exposed and be at high risk for getting monkeypox. And once that is fulfilled, then we should be able to give them the vaccine. If a person had sex with someone who had monkeypox or who is having monkeypox, then obviously that person would be at high risk, and therefore they would be eligible for you to give them the vaccine. They were basically two types that were being spoken about. And recently the WHO has renamed them because we don't want to stigmatize people from the area where this thing was discovered. And so the two types have now been renamed to Clade 1 and Clade 2. Now the clinical picture might not be very different. You still have the presentation of rashes and so forth. However, with Clade 2, they have observed that mortality is higher, maybe between 6 to 10%. So that's one of the distinguishing features between the two clades. But generally, all the signs and symptoms are pretty much the same. With monkeypox, you have to be in very, very close contact. Now, transmission of monkeypox can occur in human-to-human transmission, that is, can occur in three ways. So one, very close contact. Two, in some cases, if that person was in a room, have touched surfaces, and you touch those surfaces, there is a possibility, although a little bit more remote, there is that possibility. And then if you are in very close contact, some of the upper respiratory secretions give somebody cough, and you are very, very close to that person, you can get infected. So people ought to take precautions, especially if someone is known to have monkeypox, then you should take those precautions. But having said all of that, in Guyana we have only detected one case. We have taken all the relevant precautions, so it's not like we have people walking around with monkeypox. So again, people shouldn't panic, but they should be concerned and take reasonable measures to protect themselves.
This has been your COVID-19 update for Thursday, August 25th, 2022. For more information, visit the Ministry of Health's website or Facebook page.